The MELLO TV Evening News at 8 is brought to you by the Ministry of Health and Wellness.
Coronavirus is in Jamaica, and I know you feel scared and worried. But you can't let COVID-19 divide us. Coronavirus infects all kinds of people. It doesn't discriminate. So why should you? When someone coughs or sneezes or shows signs of the virus, tell them to call 888-1-LOVE immediately. And remember, stay 3 feet away, but don't attack or disrespect them, because we're all in this thing together. Come on, Jamaica, cut the hate and don't discriminate. Let us stand together and fight COVID-19 as one family, one nation.
Tonight, 3 COVID-19 related deaths and 82 new cases recorded on the island in the last 24 hours, taking deaths to 126 and the total of cases to 7,191. Dozens of call center agents at the Teleperformance Center in Montego Bay sent home without notice earlier today.
You can go home. Bus will be provided to transport you from here downtown so that persons can get home safely.
Still tonight, Dr. Christopher Tufton and Senator Matthew Samuda toured 2 of the island's largest correctional facilities.
In community transmission, you're going to have COVID popping up everywhere, and we have to assume that it is around us, and we have to put the measures in place, and that's why I think this visit is very important.
And PSOJ recommends that Prime Minister Andrew Holness re-evaluate his position on the matter of the chairmanship of the sessional committees of the House of Representatives. Good evening. 3 COVID-19 related deaths and 82 new cases were recorded in Jamaica in the last 24 hours. This takes the death toll from COVID-19 to 126, while the total of recorded cases on the island is now 7,191. Now, according to the Ministry of Health and Wellness, the deceased are a 67-year-old male from St. Anne, an 84-year-old female from St. Mary, and an 88-year-old male from St. Catherine. 1 other death is currently under investigation. Now, of the newly confirmed cases, 46 are females and 36 are males, ranging in age from 72 days to 87 years. The cases were recorded in St. Catherine with 30 cases, Kingston and St. Andrew 19 cases, St. James 8, Clarendon has recorded 5 cases, Manchester, St. Mary and Westmoreland 4 cases each, St. Elizabeth 3, St. Anne 2, Hanover, Trelawney and Portland 1 case each. There are 29 moderately ill and 12 critically ill patients among the 4,268 cases now under observation in Jamaica. Meanwhile, recoveries increased by 26, taking recoveries to 2,700. In news from St. James, dozens of call center agents at the Teleperformance Center in Montego Bay were sent home without notice earlier today. More on this story with Kelleen May.
Dozens of call center agents employed to the Montego Bay-based Teleperformance Center, formerly known as Alliance 1, which is located on the Montego Bay Free Zone in Montego Bay, St. James, were sent home without notice today after an employee at the facility reportedly turned up for work and displayed high fever and flu-like symptoms.
You can go home. Bus will be provided to transport you from here to downtown so that persons can get home safely. You will be notified when you are to come in. So please, do not sit and wait. Are everyone out here hear me clearly? Alright, so what is going to happen? If you want to wait on the bus, you can. If you don't want, you can go. But you'll be notified when you are to come in. So please, don't stand out here wasting time, crowding up, and don't get home.
Our news center was unable to get comments from anyone in management, even with attempts that were made. However, after speaking with some employees, we were informed that they were informed of the situation by their supervisors and told to go home.
I report to work this morning. We were supposed to report to work at 11. Got a message that we were supposed to report at 11. And I came to work at the correct time, and they were doing some cleaning inside. Yes, the cleaning is to sanitize the building, just to protect us from the coronavirus.
It is also reported that the employee was immediately sent back home and instructed to visit the doctor for an official medical evaluation. We will bring more on this story in subsequent newscast. Reporting for MELLO TV News, I am Colleen May.
In other news tonight, Health and Wellness Minister Dr. Christopher Tufton and Senator Matthew Samuda toured two of the largest correctional facilities earlier today. Here is Colleen May with more on this story.
Minister without portfolio in the Ministry of National Security, Senator Matthew Samuda, and Minister of Health and Wellness, Dr. Christopher Tufton, this morning toured the Horizon and Tower Street General Penitentiaries, two of the island's largest correctional facilities, to observe the implementation of protocols established by the Ministry of Health to prevent the spread of COVID-19. Dr. Tufton said the visit is very important as to ensure all protocols are observed to safeguard especially those with comorbidities.
The prisons, as you know, operate with significant restrictions, and those restrictions in one sense is positive in terms of the COVID response. In another sense, it does create some confinement and runs the possibility of persons being infected if the virus were to enter the institution. So we have been working together, myself and Minister Samuda, to put in place the protocols for the prisons. So I am here to get a first-hand examination. So the hand washing stations, the sanitization, the consistent cleaning, the isolation area, the mask wearing, all of these are very important. And what I've seen suggests that there is definitely an attempt to put these in place and to keep these in place, and that's good. Here at GP, as you know, we had a number of inmates and I believe warders being positive. So I visited the block where they were being treated. Luckily, for the most part, the inmates are asymptomatic, so that's good, and I'm sure they'll recover. But again, we can't take any chances because you have members of this population who are old and infirmed with comorbidities, and if you have an outbreak in the population and they're affected, then the consequences could be dire. So all in all, I think there's definitely an attempt to keep the protocols, having put them in place. I want to commend the minister and his team for what they are doing, and we just want to keep it that way.
Dr. Tufton further said that if adjustments need to be made to the health protocols in the prison system, that will be done.
Based on what the public health team have put in place in consultation with Dr. Poe, who is, as you know, the person in charge of the medical team here in the prison system, we think it can be adequate or is adequate, but COVID is evolving, and so whenever we think that there's a need for adjustments, now, you know, our penal system has several challenges, and this has been from time immemorial. A lot of attempts have been made to improve the infrastructure, but you will be at a disadvantage in some areas, which may mean a response that is more than what is the minimum standard. So things like the consistent cleaning or cleaning more often, things like some overcrowding in one or two of the areas, those may require some adjustments to the protocol. So when I have made suggestions which were received, and I know the team here are doing their best. So if adjustments have to be made, I don't see an issue with making those adjustments because everyone is willing and committed to do what is best for the inmates and for the staff.
Senator Matthew Samuda says a full review of the low-risk prisoner release system will be addressed definitively by next week.
We looked from March at what the WHO was recommending for corrections facilities. We looked from March at what the CDC was saying, and we've continued to monitor all communication from MOH and certainly anything that's published from PAHO. And what we've implemented follows a checklist that we would have consolidated from those, while we looked at our own realities and our own constraints. The issues facing the correction system are well known and have been documented over decades. We've put what can be put in place within the infrastructural challenges that we have, and thus far I want to commend the senior team in corrections for the work that is being done. To note, there are a number of groups and there is an approach that we will outline very shortly in terms of how we intend to deal with the question of the most vulnerable, those within say 3 months of end of sentence, how often the parole board meets, etc. We will speak to the country definitively about that next week. So the question is fundamentally how you define low-risk inmates, because I don't know that someone outside of the prison system can do that definition. There is a full process that has to be done. There is those who are at higher risk because of comorbidities, who are nearing the end of their sentence, who would be priority for different levels of protection. There are those who would be nearing the end of their sentence but would have no comorbidities and really have very limited risk to their own health and stability. So it depends on where they are, and there's an exercise underway. We're looking first and foremost at those inmates who are infirmed, and then we move down the list. But generally, just to be clear, my sense is not from the country that there is a overwhelming call for early release as a system. What we're looking at is those that are at greatest risk, because at the end of the day we do have a duty of care.
With the National Health Fund handed over personal protective equipment, PPEs and cleaning supplies to the Department of Correctional Services to boost its capacity in preventing the spread of the virus. Reporting for MELLO TV News, I am Colleen May.
In news from the capital, Jamaica's COVID-19 response was strengthened yesterday with the assistance of the Pan-American Health Organization, PAHO Jamaica's country office. Now, the organization provided essential items to support the Ministry of Health and Wellness, MOHW, at a handing over ceremony. It is reported that PAHO, through USAID funding, procured items based on the priority needs outlined by the MOHW. Now, this includes 15 intensive care unit beds, 13 satellite phones, 5 scanners, and over 2,000 risk communication materials to educate and inform Jamaican healthcare workers in health facilities and international travelers at ports of entry. These items are said to be a part of a US $700,000 COVID-19 response package to boost Jamaica's capacity to prevent, detect, monitor, and control outbreaks of COVID-19. In addition to building international and national coordination and operational support, as well as to enhance the ability of the health system to care for those affected by the virus. Now, the final stage of the handover, PAHO says, will include an ambulance and the retrofitting of an isolation facility at the Sangster International Airport, as well as support for the MOHW's risk communication and community engagement interventions and increased internet bandwidths to key health sites to enhance coordination. In news from St. Catherine, a woman detective sergeant died from injuries she received in a motor vehicle accident. Now, the incident occurred along the Mandela Highway yesterday. 4 other officers were left nursing injuries in hospital. The female detective sergeant, who has been identified as Maydeen Blackwood, was reportedly assigned to the St. Catherine South Police Division. Reports coming into our news center are that shortly after 4:30 p.m., Detective Sergeant Blackwood, who was also a member of the Jamaica Constabulary Forces Choir, and 4 other officers were traveling in a police service vehicle along the Mandela Highway. Further reports coming into our news center are that the driver lost control of the vehicle, which overturned and crashed into a nearby ditch. The wounded officers were rushed to the hospital, where Detective Sergeant Blackwood was pronounced dead and her colleagues treated. Now, following the news of the death of Detective Sergeant Blackwood, chairman of the Police Federation, Detective Sergeant Petray Rowe, spoke with our news team, describing her as being loved by all.
The Police Federation is mourning the loss of our dear colleague, Woman Sergeant Blackwood, was a woman who was truly loved. She sang on the JCF choir. She was popular among our membership. She's a beautiful woman from all accounts. She was truly loved by everybody she came in contact with. The mood at the hospital last night was extremely somber. A number of the colleagues came by to look and just to support each other, embrace each other in this very difficult time. We stand at this time with her family. We mourn with her colleagues, her fellow choir members, her batchmate. She's doing over 20 years in the constabulary force. And it is indeed a sad time for us. We have endured a number of traumatic experiences over the last few days, and this is just another that adds to the mourning.
Detective Sergeant Blackwood is the third member of the Jamaica Constabulary Force to lose their life tragically within the last 2 weeks. Still making news tonight, after its review and consultation with various stakeholders, the Private Sector Organization of Jamaica, PSOJ, says it recommends that Prime Minister Andrew Holness re-evaluate his position on the matter of the chairmanship of the sessional committees of the House of Representatives. Now, in a statement released earlier today, PSOJ's president, Keith Duncan, said, and I quote, "We strongly recommend that the Prime Minister engage the Leader of the Opposition to put in place performance standards for the chairman and members of these sessional committees to ensure that they provide the oversight function that was intended and is required from these committees." End quote. The PSOJ added that civil society groups have made recommendations that can be considered in these deliberations, and oversight and scrutiny of policy is paramount. Now, the PSOJ says it has received clarity that the development and execution of government policy and projects will not and have not been hampered by the relative inactivity of these committees, stating that notwithstanding, it is disappointing that elected legislators have not provided an acceptable level of oversight, review and scrutiny of government policy positions that fall under the purview of these sessional committees. While the PSOJ believes this disregard of national duty should not be tolerated, it says it also does not believe that removing the oversight function from the opposition is an acceptable solution, adding that Jamaica is a maturing democracy and we must be deliberate in efforts to build more transparent institutions on the principles of accountability with the appropriate checks and balances that protect the Jamaican people. In other news tonight, Tourism Minister Edmund Bartlett says his ministry remains committed to working with Jamaica's rural communities to strengthen their resilience, create jobs and build economic opportunities. While speaking at the Tourism Awareness Week webinar hosted at the Jamaica Pegasus Hotel recently, the minister said, and I quote, "As we reimagine our tourism product in these uncertain times, the focus on rural development seems quite timely. Tourism in rural areas will provide key opportunities for recovery as these communities seek to bounce back from the harsh economic setback caused by the pandemic." End quote. Now, Minister Bartlett also outlined that one key project of the Ministry of Tourism and key partners will be completing soon to benefit rural communities Jamaica's first artisan village at the Hampton Wharf in Falmouth. The project is now on target to open at the end of 2020. The TEF-financed project will see other artisan villages being established in Ocho Rios, Montego Bay, Port Antonio, and Negril. And those were the stories making news. I am Shelley Hill. We'll now take a break and then join Christopher Scott with sports.